Hi, I'm Dr. Harsha. I'm professor of orthodontics. I've been practicing orthodontics for the past 9 years now. So today I'm here to just discuss about my specialty orthodontics. So first let us think why, what is orthodontics and why do you require it? Orthodontics is a specialty, in fact the first specialty of dentistry, which deals with bad bites, correcting bad bites, or in a way the aim of orthodontics is, it's a triad, something called as Jackson's triad, which involves aesthetic harmony, functional efficiency and structural balance. In simple words, it's just restoring good aesthetics, very good efficient function, and again a good health of both dental and its supporting tissues. So let us see, look, basically malocclusions have become much more rampant nowadays because of increase in the communications and gene pooling. That's one of the main reasons why, because if you just remember or if you just think about the olden generations, they never used to have this kind of much of problems with the teeth alignment or else even with the functions. So nowadays obviously we see much more complicated cases and compared to the olden days. Okay. Let us see why you require orthodontics. Obviously, whenever you have a mal-aligned teeth or misplaced or which can't function as a unit, and again obviously when the teeth are not aligned properly, even the patients are not able to clean the teeth properly. Okay. So obviously when you put the teeth into its proper position, all these three things, who doesn't want a good smile? So the main aim of orthodontics is to restore all these things. One is good aesthetics, second one would be a very good function, and again the third one should be it's the health of the tissues. Okay. This is why you require orthodontics. Obviously orthodontics as a branch can be broadly divided into four different kinds. One is something called as preventive orthodontics, interceptive, then again corrective and surgical. So if you just look at these, happen to be in different stages of development basically. So if you just think malocclusion as a process, okay, so preventive orthodontics deal with the procedures which are instituted to deal to prevent the causes of malocclusion. So we know that this, if this is going to continue, say for an example restoring a milk decayed tooth, okay, we know whenever there is a decay there is a loss of tooth structure. So obviously we all know that permanent teeth or the molars generally erupt at age of 6 years. Say for an example your second deciduous molar or the second or the last milk tooth, which is a bigger tooth, an important tooth basically, so gets decayed, and obviously when there is a decay the structural size of the teeth is reduced, so that the molar is going to invade into the second deciduous molar space. So that's how the space which is supposed to be there for the erupting premolars or the future permanent teeth is lost. Okay. So when we see this preventive branch of orthodontics generally deals with correcting, taking care of all those things. Just a simple restoration should do a job for us, which if just left just like that would probably must develop into much more complex situations. So these are the different, some of the preventive procedures which I will be speaking much more detail later in the talk. Okay. Next, interception is something I told you, just think about the malocclusion as a process. Okay. Now preventive measures are there to prevent the process happening, okay, whereas interceptive measures are there to intercept. I mean the process of malocclusion is already started, so we are intercepting the process in some stage to make it less complex. Okay. So there are a lot of ways. Again, now the spaces are already being lost, just regaining the spaces, or else something called as serial extractions, which we just know that when we allow the dentition to grow as it is, which is not right, they're going to present us in a much more complex situations later. So when we know that situations are there which can happen, so we just institute some procedures to prevent that or lessen the complexity of the malocclusion. This is something which is dealt by interceptive orthodontics. Now once the whole malocclusion process is complete, so then the corrective orthodontics comes into play. So there we know the whole procedure, the malocclusion is already expressed its complete features, so we are going to correct them. So at stage whatever we see that basically. So that might involve extractions, non-extractions, or growth modulations, growth modifications, or even surgery. These all depend on what time we see the patient and what is the growth status of the patient and what the nature of malocclusion we are dealing with. Okay. So the next branch is something called as surgical orthodontics. Okay. This, as a in a broad sense, look, if you just speak of surgery, even extraction is a surgical procedure. Okay. So if you just take it in a broader sense, sometimes we deal with malocclusions which will have skeletal features in nature. Malocclusions in general can happen at 3 different levels. If you just take a jaw, it can just happen at all 3 different levels. One, the teeth. So this is called a dentoalveolar part. Okay. The jaws as such might be very, very normal, but the teeth themselves can be malaligned or malpositioned. So that malocclusion is limited to the level of teeth alone. Okay. The second one would be something called as dentoalveolar region, where the malocclusion can extend to the bone where the teeth is housed. Okay. And the much more important thing is the malocclusion can happen at the jaw level itself. Okay. We all know the upper jaw is called as maxilla, the lower jaw is called as mandible. So if the jaw themselves are not related properly, obviously we are bound to see a much more different situation. So that generally we read it as mal relationship of the jaws. Okay. Based on this, okay, based on where we are looking at the problem, at what level the treatments are instituted in fact. So this is something like a skeletal thing which involves the correction. Now when we speak of correction, again, when we know where exactly is the problem, we try to correct the problem at its cause, because obviously once you correct the causes, then the relapse chances or the problem coming back again is not there. Okay. So when we think about